Assalamu alaikum viewers, this is Dr. Muhammad Iftikhar Aslam from Pakistan. Today I'm going to present my lecture on Hendra virus infection, which is also known as equine morbillivirus pneumonia or acute equine respiratory syndrome. In today's lecture, we will cover the information regarding the organism that causes Hendra virus infection and its epidemiology. We will also talk about the history of the disease, how it is transmitted, species that it affects, including humans, and clinical and necropsy signs observed. Finally, we will address prevention and control measures of Hendra virus as well as actions to take if Hendra virus infection is suspected. Hendra virus, formerly known as equine morbillivirus, is a relatively recently recognized member of the Paramyxo family, genus Henipavirus. It is closely related to another recently discovered virus, Nipah virus. It is enveloped single-stranded RNA virus. This family includes the viruses that cause mumps and measles, rinderpest virus infections, human parainfluenza virus infection, and canine distemper virus infection. Hendra virus was first isolated in 1994 from the specimens obtained from an outbreak of respiratory and neurological disease in horses and humans in Hendra, which is a suburb of Brisbane, Australia. Of 20 horses that suffered from severe respiratory disease in September 1994, 13 died. Two people looking after the index horse case developed a disease, one of them died. Two other horses developed fatal infections in a separate location that same year. In 1995, a third human case was recorded and thought to be associated with an earlier outbreak in another part of Queensland. The patient who later died had assisted in the post mortem examination of two horses in August 1994. The scientists have shown that Hendra virus is not highly contagious. The mode of transmission from bats to horses is unknown. Infected fruit bats may pass the virus in their urine and saliva like the closely related Nipah virus. However, Hendra virus has not yet been isolated from the urine or saliva of the fruit bats. Research suggests that the horses can be infected by eating material contaminated with virus. Hendra virus is shed in birth products, including aborted fetuses and placenta. The fact that most equine cases have occurred during the birthing season for fruit bats seems to support this mode of spread. There is no evidence that the virus can be spread via inhalation. Horses have shown similar clinical signs among the outbreaks. The incubation period is from 8 to 16 days, with 4 to 10 days after experimental inoculation. The horses may be asymptomatic during this period but are able to shed the virus. Clinical signs considered of anorexia, depression, sweating, and a fever of up to 105.8 degree Fahrenheit. Most horses showed elevated respiratory rates with a clear to pseudosanguineous nasal discharge during the initial course of the disease. Sudden death of the horses was often seen in 1 to 3 days after the onset of clinical signs. Some convalescent horses may develop neurological signs, but others seem to recover fully. As the disease progresses, mucous membranes may become injected with a cyanotic border. Horses may show dependent edema, ataxia, and head pressing. The nasal discharge may become frothy and red just prior to death. Sudden death of horses was often seen 1 to 3 days after the onset of initial signs. Diagnosis of Hendra virus in animals is same as in humans. In addition to horses and humans, it has been shown that the cats, pigs, guinea pigs, and ferrets can be infected with Hendra virus experimentally, resulting in severe clinical disease. There have been no cases of natural disease in cats. Serological surveys of cats throughout Queensland have yielded no positive cases. Other animals that have been exposed to the virus experimentally included dogs, chickens, rats, and mice, although none have shown any signs of infection. Before collecting or sending any samples from animals with a suspected foreign animal disease, the proper authorities should be contacted. Samples should only be sent under a secure conditions and to authorized laboratories to prevent the spread of the disease. Now, if you suspect Hendra virus infection, state or federal authorities should be notified immediately. Animals suspected with Hendra should be isolated and the farm should be quarantined until the definitive diagnosis is determined. The risk of transmission of Hendra virus from sick animals to humans appears to be low. Because of scarcity of the information, it is difficult to adequately assess the risk. Sick horses in endemic areas or in areas inhabited by fruit bats may be at the increased risk. If infections with Hendra virus is suspected, do not handle the infected tissues or waste products, particularly blood or urine. Horses that develop severe respiratory diseases should be considered contagious, and standard infection control measures should be taken to avoid spreading the virus on the fomites. Quarantine and rigorous hygiene have been effective in containing past outbreaks. The low rate of horse to horse transmission also aids the control. There is relatively little known about Hendra virus infection, including the transmission routes in humans and animals. Based on the limited data available, it is suspected that the mortality rates could be very high. Effective treatment for the disease is also unknown at this time. Its use as a biological weapon is unknown, as are the consequences. So that's the end of our today's lecture. Thank you so much.